evening, everyone. I want to welcome you to this presentation on canine hemangiosarcoma. And I'd like to thank our series sponsor and partner, the AKC Canine Health Foundation, as none of these webinars would be possible without their generous support. CHF is the largest funder of health research focused just on dogs, and their portfolio and funding of projects totals more than $37 million. All of these projects supporting the health needs of dogs and the development of scientific innovations to not only benefit our dogs, but also to potentially translate into the world of human health care. With that, I want to hand over the mic to a special guest joining us tonight. Samantha Wright is here joining us on behalf of the Foundation. Samantha is Program Manager, and I'd like for her to say a few words. Samantha, I want to welcome you.
Thanks, Dr. Berger, and thanks for that great introduction to the Foundation as well. Thank you all so much for joining us tonight and taking time out of your busy schedule to participate. We're so thrilled to have Dr. Doug Tham with us tonight. He's a longtime friend of the Canine Health Foundation. Not only has he received several research grants throughout the years, he also frequently contributes his time and expertise to our educational programs. So thank you so much again, and thank you, Dr. Tham, for once again supporting CHF and our mission to disseminate canine health information.
Thank you, Samantha, and thanks again to everyone at the Foundation for your support of tonight's event. With that, I'd like to go ahead and introduce our presenter this evening, Dr. Douglas Tham. Dr. Tham is a board-certified veterinary oncologist and is the Barbara Cox Anthony Professor of Oncology and Director of Clinical Research at the Colorado State University Flint Animal Cancer Center. Dr. Tham has authored over 120 peer-reviewed publications and 20 book chapters in veterinary and basic cancer research, and he is the co-editor-in-chief of the Journal of Veterinary and Comparative Oncology. His clinical and research interests include novel targeted therapies for animal and human cancer and ways to integrate these therapies with existing treatments. Dr. Tham, we have a very enthusiastic audience eager to hear what you have to say about this important topic. I want to welcome you, sir, and the floor is now yours.
Great. Well, thanks very much, Sherry. And again, I'd like to also really acknowledge the support of the AKC in sponsoring these sessions. And again, thanks again, Samantha, for that nice introduction. And thanks to all of you who are listening for spending your evening, hopefully learning a little bit about canine hemangiosarcoma. As I mentioned, I'm at the Colorado State University Flint Animal Cancer Center, where I wear a number of hats. So in addition to being the Director of Clinical Research, I also still do work in the clinic about 12 weeks a year, teaching the students, teaching the residents, and seeing animals with cancer. And then I also maintain a research laboratory where we train graduate students and postdoctoral fellows and do basic cancer research, mostly about canine cancer. So again, standard conflict of interest slide. You do see a couple of things in orange here. So these are things that I will mention very briefly tonight. So I am involved with a company called VetVine that has a drug that we're exploring for canine hemangiosarcoma. And I also have a very, very, very small revenue stream from a company called the Veterinary Diagnostics Institute for a test that measures an enzyme called thymidine kinase that I'll also mention later in the talk. So do want to make sure that you're aware of those conflicts of interest. So some real basic information about hemangiosarcoma that I think most people who are on this call probably have a pretty good understanding of already. So this is a tumor that's actually derived from the blood vessels themselves, specifically the cells that line the inside of the blood vessels called the endothelial cells. And one of the things that's been really quite frustrating about hemangiosarcoma in dogs over the years is that this is a disease that's really exquisitely rare in humans. With many other tumor types, lymphoma, osteosarcoma, for example, we're able to take a sort of a page from the human book. So we look and see how people with this disease get treated, with those diseases get treated, and we say, wow, why don't we try that? And we see how that works. And that's worked quite well for us for treating, again, other diseases like lymphoma and osteosarcoma. But because hemangiosarcoma is so incredibly rare in humans, we've really kind of had to make this one up as we go along. And no one really understands why it is that hemangiosarcoma is so much more common in dogs than it is in humans. Interestingly, it's also a relatively common tumor to find in mice that get spontaneous cancer, but in people it's just very, very rare. We do know that any breed of dog can get a hemangiosarcoma, including mixed breed dogs, but there are some classic breeds that tend to be overrepresented, and the two that are most commonly referred to are the German Shepherd and the Golden Retriever. Certainly there are others. I don't want to leave out some of the other breeds where we know there's a predisposition, the Belgian Malinois, the Portuguese Water Dogs, Boxers, a few others as well. But these are the two that really tend to get the most press when you're talking about breeds that are at really significantly increased risk for this disease. Because this is a tumor that's derived from blood vessels, and obviously there are blood vessels all over the body, this is a tumor type that can occur anywhere. And we have seen it just about anywhere you can possibly imagine. But for reasons that aren't completely understood, there are certainly some parts of the body where we tend to see them more commonly than others. And the most common locations are the ones that you see listed here. So the spleen, the skin, the liver, and the heart. For the most part, this is really a problematic disease, not only because it can take up space in an organ, it can cause local problems like bleeding or pain, but this is a kind of tumor that tends to spread very rapidly. There is one important exception to this rule that's really great for everybody to remember, and that's these purely cutaneous hemangiosarcomas that we can see. And again, classically, we'll often see those, for example, in the inguinal area, so in the belly area, the groin area of short-coated, light-skinned dogs, especially those that really like to sunbathe. So your white boxers, your pitties, bull terriers, those kinds of guys can actually get a fair number of these. And in those particular circumstances, we think that they're actually caused by ultraviolet light in the same way that some human skin cancers are. And again, the distinction is important because those ones that are purely cutaneous really don't tend to spread very often. We tend to see local recurrence in some circumstances, but contrary to just about all the other hemangiosarcomas that we see, these don't tend to spread as much, which is great. Why do dogs get hemangiosarcoma? You know, this is a question that we get all the time, not just about hemangiosarcoma, but about most kinds of canine cancer. And the unfortunate answer is that for the majority of cases, we simply don't know the answer to that. So to the extent that it's been looked at, unfortunately, most forms of cancer in dogs and in humans too just really appear to be unfortunate accidents that occur as a result of errors in DNA replication and cell division. People have looked for some specific things in dogs with hemangiosarcoma, and we know that laboratory dogs can get hemangiosarcoma if they get extremely high doses of certain kinds of toxic chemicals like polyvinyl chloride, anabolic steroids, interestingly, and radiation are all things that, again, can cause these to happen in laboratory dogs, but the doses of these things that are required in order to cause these hemangiosarcomas in the laboratory dogs are so high that it's highly unlikely that they contribute meaningfully to sort of environmental exposures in our homes. As I mentioned, it does appear that some purely cutaneous hemangiosarcomas may be caused by ultraviolet. In humans, there's a little bit of evidence to suggest that herpes viruses may be involved in the development of certain kinds of vascular tumors. People have looked at the human equivalent of hemangiosarcoma. There's another vascular tumor called Kaposi sarcoma, which occurs commonly in AIDS patients, which has a very strong association with herpes virus, and we just don't know about this in dogs. There's a recent study from Dr. Breitschwartz's lab at NC State that actually found the DNA for a bacterium or a parasite called Bartonella in about a quarter of spleens from dogs with hemangiosarcoma versus only about 10% of dogs who had other kinds of splenic diseases. But do we know that this is a cause? No, we certainly don't. It's just kind of an interesting observation at this point. So again, just like most of the other tumor types that we know about, we don't think that feeding the wrong food, we don't think that having them drink the wrong water, We don't think that putting too much chemicals on your lawns or anything else like that really substantially contributes to this risk. And I always feel like that's a really important thing to discuss with owners, because some owners feel so guilty that, oh, maybe I did something wrong in the way I brought up my dog that led him to get this disease. And again, for almost all the cases we know about that, I think we can really say that the answer to that is no. So what about early spay-neuter? So this is a question that we get fairly often, not just with hemangiosarcoma, but with some other diseases as well, some other cancers as well. And again, I think there's really some pros and cons to this early spay-neuter thing from a bunch of different perspectives. It's not only a cancer thing. There's incontinence, there's orthopedic diseases, there's behavioral diseases, etc. I'm not an expert in any of those other things, so I'm really going to restrict my comments to what we know about cancer. And in this case, again, what we know about hemangiosarcoma specifically really boils down to just a single study. And this was a study that was done in Vizslas, where they actually looked at the age of spay or neuter and the incidence of a variety of different kinds of cancer and behavioral disorders. And hemangiosarcoma was one of the ones that popped up on the list as potentially being related. But if you look at this little chart here, and again, the highlighted area is hemangiosarcoma, you'll notice something that's kind of weird and interesting. So again, it appears that intact dogs, which are the ones on your far right there, have a very low incidence of hemangiosarcoma. But similarly, dogs that are spayed before 6 months of age, and even dogs that are spayed before 12 months of age also have a very, very low rate of hemangiosarcoma. So the only place where this increased risk seems to occur in dogs that are spayed after 12 months of age, which is really kind of hard to explain mechanistically. So what would be going on as far as exposure to estrogens and things like that would potentially lead to this kind of thing? Really, really hard to sort of come up with a scientific reason why this would be the case. And for that reason, it's really hard to know what to do with this information. I think if we saw it in all of the spayed dogs compared to all of the intact dogs, that would make more sense. Or if we saw it even more severely in the dogs that were spayed earlier, that would make more sense. But this is one that's a little bit hard to figure out. So I don't know really what to do with this piece of information at this point. And one of the other interesting things that's worth pointing out about this information is, despite the fact that it did look like there was an increased risk of hemangiosarcoma in dogs with certain spay statuses and some other cancers as well, there was absolutely no difference in their overall lifespan. So what that implies is that the incidence of cancer might be a little higher in some circumstances, but that's balanced out by some other potential beneficial effects of spaying early. So based on this paper, it really appears that, yeah, there may be some little differences in cancer incidence, but the overall survival time of these dogs is actually the same whether they're spayed early or not. So still a work in progress. There's still additional studies that are coming out that are really trying to shed more light on this particular issue. So not enough information for us to really make any very specific recommendations as it pertains to hemangiosarcoma at this time, unfortunately. So what about at the level of sort of genetic changes in the tumors? So what do we know about what's going on in the tumor DNA? So we do know that there's some fairly classic tumor suppressor genes that are mutated commonly in human cancer as well as in other canine cancers that also appear to be dysregulated in hemangiosarcoma. So two of these are P53 and P10. And P10 is one that I'll mention briefly because we'll talk more about this pathway in a minute. So P10 is what's called a negative regulator of a pathway called AKT. So AKT is important for regulating cell survival and cell proliferation and things like that. And mutations in this gene P10 actually cause that pathway, that AKT pathway, to be overactive. So, and the reason that that's potentially important is that there are some drugs that I'll talk about at the end that may actually work by interfering with signaling through this AKT pathway. There does appear to be some dysregulation in growth factors that help to control the development and growth of normal blood vessels. So this is a cancer of blood vessels, so it kind of makes sense to think that these cancer cells might have taken some of the tools that are usually used to control the growth of normal blood vessels and used them to their advantage. And it actually appears that that's the case. So some particular growth factors, and again, one that we'll get back to in a second is vascular endothelial growth factor, that's important for normal blood vessel growth, appears to be even more important and more highly produced in hemangiosarcoma. So one of the interesting things when it comes to sort of looking at genes and which genes are turned on and which genes are turned off in hemangiosarcoma is some really nice work that's been done by Dr. Modiano's lab at University of Minnesota, much of it AKC funded, that's actually demonstrated that not all hemangiosarcomas are created equal. So in this first little study that was done, they actually were able to demonstrate pretty convincingly that the hemangiosarcomas that arise from golden retrievers are actually pretty different in terms of their sort of genetic pathways than the tumors, the hemangiosarcomas that arrive in non-golden retrievers. And they went on to actually show that this might have some important ramifications for things like sensitivity to certain kinds of targeted drugs that are being developed and things like that. So a very interesting finding that, again, at least based on this, golden retrievers may get hemangios that are a little different from other breeds. And then the second study actually looked at a larger number of hemangiosarcomas from a bunch of different breeds and actually found that they were able to cluster into three sort of big groups based on their gene expression. So one was what was called a hypoxic gene expression, so it looks like cells that aren't getting enough oxygen. Another was an angiogenic gene expression, so really looks a lot like those normal blood vessel cells. And then the third was a gene expression profile that looked a lot like inflammation. And so again, even if you take breed out of the equation, it does appear that there may be some sort of molecular subtypes of hemangiosarcoma. And at this point in our sort of understanding in our drug development pathways, we don't know how to sort of take use of this information for example, individualizing treatment. But in the future, there certainly may be little tests that we can do to know which of these three classifications an individual hemangiosarcoma falls into, and then sort of dial in our therapy, sort of specifically for that particular subtype of hemangiosarcoma. So stay tuned for that. So what about genetics? One of the other questions that we get is this a genetic disease that can be passed down from generation to generation? Is there a genetic test that I can do to help breed it out of our dog populations? So there's a single paper now that's actually come out that started to try and answer this question. And this, I think, came out last year from, again, Sharsten Lindblad-Toh and Matthew Breen and Jaime Modiano. Again, a lot of folks who have received funding from the AKC before. And these guys did a form of genetic study called a genome-wide association study. And sort of this is a really fancy way to look at it in a huge number of genes all simultaneously using a sort of a chip-based approach. So what they did was they took a whole bunch of dogs with, actually in this case, just golden retrievers with hemangiosarcoma, or in this case, lymphoma, and compared them to a whole bunch of dogs that had lived to a ripe old age, golden retrievers again, without developing either of these two diseases. And then basically compared their genomes for areas of individual genes or areas of individual parts of the genome that might be different between those two groups of animals. And what they found is that there were in fact some areas of the genome that appeared to be different between dogs with hemangiosarcoma and dogs without. This little fancy graph that you see here is what's called a Manhattan plot. And basically, the higher the little dots are that you see, the more significant the association is between a chromosome or a part of a chromosome and this tendency to develop hemangiosarcoma. And those little red dots are the ones that are actually statistically significant. So what you're actually seeing is chromosome number along the bottom there. So they actually identified regions of chromosome 5 and chromosome 12 in the canine genome that seemed to be associated with hemangiosarcoma risk. And when they sort of coned down onto the very, very specific little area of the gene that appeared to be responsible for this, they actually found two genes that seemed to confirm most of the risk. And neither of these are like super classic, super famous cancer-related genes in people. One of them is a gene called TRPC6, which is a calcium channel whose function can be interfered with, again, with the wrong kind of genetic mutation. And this appears to be a regulator of T-cell activation. And again, it may enhance signaling through that same pathway I mentioned previously, the PI3 kinase pathway. So this implies that maybe regulation of immune response could be one important determinant of whether an animal gets hemangiosarcoma or not. And the other one is a protein called STX8, which appears to be important in sort of moving certain kinds of molecules from inside the cell to outside the cell, but there's actually very little known about its importance in cancer, although again, it appears that it may have some importance in regulation of immune function. So both of the genes that they sort of identified here suggest that maybe an impaired immune response or some dysregulation of immune function could be partly responsible for the increased incidence of hemangiosarcoma that's seen in some golden retrievers. So the next logical question is, hey, is there a genetic test that's available that I can actually use to determine if my golden retriever is a carrier for one or both of these what are called risk loci, so these genes that are weird? And the answer is, as far as I've been able to tell, the answer is no. So it doesn't appear that anybody has commercialized a test for these particular markers yet. Some of you may be familiar with a test that is available for assessing risk in Bernese mountain dogs for malignant histiocytosis that's sold by a French company. But it does not appear that anybody's commercialized these particular findings yet for dogs with hemangiosarcoma. So as things stand right now, I don't know anywhere where this genetic test can be performed, unfortunately. So how is a dog with hemangiosarcoma likely to display the fact that they're sick? Well, one of the things that's incredibly frustrating, both for us and certainly for owners of dogs with hemangiosarcoma, is, boy, sometimes this is a disease where they really just don't let you know that they're having problems until something really catastrophic happens. So in dogs with these visceral forms of the disease, the ones that occur in locations like the spleen or the liver or the heart, the number one complaint that we hear about is this history of intermittent weakness or collapse. And sometimes the very, very first episode is incredibly severe or life-threatening, and they're rushed into the emergency room right away and a diagnosis is made. But sometimes, if we quiz the owner, they may say, oh yeah, you know, a week or two ago, he kind of felt a little weird for a day or two, you know, didn't seem like himself, was kind of sleepy and lethargic, and then he kind of got better. And maybe those episodes have happened several times, but they're getting more frequent or getting more severe. But again, it's this sort of history of acute. All of a sudden, they go from kind of being normal to being, whoa, I feel kind of tired. Would be one of the most common sort of presenting complaints that we have in dogs with hemangiosarcoma. And what we think is going on in these dogs is that the tumor is actually rupturing into the abdomen or rupturing into the sac around the heart. And when that ruptures, they lose enough blood that it actually makes them feel very weak. But then over the next 24 to 48 hours, those red blood cells basically sort of get sucked back into circulation and they kind of auto-transfuse themselves and end up feeling much better. But we know that those kinds of episodes have the potential to happen again in the future. Some dogs may have other signs of illness in between those episodes, really vague, nonspecific stuff like lethargy, poor appetite, exercise intolerance, so not wanting to do as much, those kinds of things. And during these episodes, especially during the more severe episodes, again, one of the things that you can appreciate at home might be a change in the color of their mucous membranes, their gums. So getting familiar with the color of your dog's gums is a great idea for the starters. And again, normally it's a nice pink color, so that if you experienced an episode like this, and you saw that your dog's gums was more like the color that you see here, this kind of whitish color or grayish color, that would unquestionably be abnormal. And one of the many things that could cause an appearance like that could be a disease like hemangiosarcoma. Certainly other causes of blood loss and other kinds of diseases can do that as well. But that's usually something, if you saw, you'd want to seek out medical attention soon for your pet for that. So how are we going to make a diagnosis, and what tests are we going to do on a dog that we think might have hemangiosarcoma? So some real basic blood work is often something that we'll start with. Unfortunately, there's nothing on sort of basic blood work that's going to be a guarantee of hemangiosarcoma. But some of the things that we see that are reasonably common are, again, anemia, low red blood cell count, often due to these episodes of bleeding that have happened before. Low platelets are quite common, although usually not dangerously low, but a little bit lower than normal. And a lot of these dogs may have a little bit of an increase in their white blood cells too. Again, that's not necessarily an indication of any kind of infection. a fair number of these dogs may have some increases in their liver enzymes. And one important thing to know is that just because we see increases in their liver enzymes doesn't mean they have spread to their liver automatically. So if you see that, it doesn't mean, oh, forget it, we can't possibly do anything to help this guy because his liver enzymes are elevated. This is often a nonspecific finding that can actually go along with anemia. If the liver doesn't get enough oxygen because there aren't enough red blood cells floating around, often it can respond to that by raising some of its enzymes. So it's not a guarantee of liver spread if you see elevated liver enzymes on blood work. A lot of times we will recommend doing some other simple tests of blood clotting ability because we're thinking about doing surgery and we want to make sure that clotting is going to be okay before we start to do surgery. An abdominal ultrasound is an incredibly useful test for these dogs. Again, since the most common location that we see, probably if I have to pick one, is the spleen. Looking at the spleen is very easy with ultrasound. Even if they have fluid in their belly from a recent episode of bleeding, ultrasound cuts through that fluid really easily, so it doesn't make it harder to see what's going on. And it does allow you to get a really good look at the rest of the abdomen as well to make sure there isn't anything, God forbid, that looks like spread. Plain old abdominal x-rays are not very good because often these tumors are pretty small. And if there's fluid in the belly, actually the quality of a plain old x-ray is actually considerably worse. So ultrasound's a really much better test if possible. And always we recommend chest x-rays on these guys before surgery. And the reason for that is, again, as I mentioned, this is a tumor type that spreads pretty frequently. And unfortunately, dogs that have obvious evidence of spread, for example, to the lungs, really have a quite poor prognosis. And a lot of owners will think twice about wanting to do surgery in a dog who has obvious evidence of spread. I have echocardiogram here in parentheses for a couple reasons. So obviously, if we're worried about a primary hemangiosarcoma of the heart, an echocardiogram is really going to be very, very important to make that diagnosis. Some folks will do it as part of what we call staging, so another place to look for spread to make a decision about whether doing surgery is appropriate or not. And there's no question about it that if you do look for evidence of spread to an organ like the heart, in a dog with, for example, a primary splenic hemangiosarcoma, once in a while you will find it. So in one study that we performed here recently, about 7% of dogs would have involvement of both the spleen and the heart simultaneously. But actually only about 3% of those dogs had splenic hemangiosarcoma in the spleen, in the heart, and nowhere else. So in other words, usually you'd find it somewhere else, either in the lungs or in the liver, before you needed to look in the heart. So the reason that I bring this up is, if it's really, really easy to do a quick echocardiogram to take a look at the heart as part of your thorough search for disease elsewhere, sure, it's great to do, but I wouldn't not do surgery on a dog, especially a dog who might be presenting urgently while you're waiting for an echocardiogram. Oh, our cardiologist is going to be in next week, he can do one then. No, if you've got a dog that's having serious problems, I think the likelihood of finding something is low enough that you can feel comfortable moving forward without that echocardiogram. If we have a dog who's in serious trouble, we'd much rather do that than wait for a prolonged period of time. One of the sort of fundamental tenets of oncology that we practice is, biopsy everything, poke needles into everything to see if we can find out what they are. And there's no downside to fine needle aspirates in tumors that we suspect might be hemangiosarcoma, but unfortunately, it's usually pretty hard for us to actually get a diagnosis from a simple needle aspirate. And the reason is, when we do that test, usually what we see is just a whole bunch of blood. And somewhere down there are probably a few tumor cells, but they're so few and far between compared to all the blood that we see that it's really, really hard to make that diagnosis. So it's never wrong to try, but again, it's often not very rewarding compared to a lot of other tumors that we try to diagnose that way. Biopsy, so a true honest-to-God biopsy, like a needle, what we call needle core biopsy or true cut biopsy of something that we're suspicious of maybe being hemangiosarcoma in an organ like a liver or spleen, is something I probably wouldn't do. And the reason for that is that we may take a hemangiosarcoma that hasn't ruptured yet and rupture it with our fat needle. So again, a little tiny needle, probably not going to do any harm. Big fat needle, like the kind we use to get not just aspirates, but biopsies, we get a little bit more worried about trauma to the tumor that could lead to bleeding. And the reason that that's important is that tumors that have bled into the abdomen actually have a worse outcome than those that are removed before they have bled. So if we can avoid that, that's actually a good thing. So normally for disease in the belly, if it appears like it's solitary, something that we can remove, we actually recommend getting our diagnosis by surgery rather than trying to poke needles in it or get biopsies or anything else like that. So what about treatment? So just like with most other cancers, if they're localized, surgery is unquestionably the first line of defense. Obviously, in those dogs that unfortunately might have obvious evidence of disease in multiple parts of the body, that can become much more tricky. But for dogs with localized disease, surgery is definitely the place to start. And there are some special concerns about surgery for hemangiosarcoma that we like to keep in mind. So one is bleeding. So these tumors might be bleeding at the time the dogs go into surgery. These dogs might already be anemic. They may continue to bleed during surgery. So it's really, really nice to, again, have a little bit of information about how well they're clotting their blood beforehand to make sure that they're going to do okay. And it's really nice to have blood products available in case they need them during surgery as well. So that might be packed red blood cells. It might be a fresh unit of blood from a donor dog. But having that ability in wherever the surgery is being performed is really a nice safety feature. Not every dog needs it, but if you do need it and you don't have it, you could really find yourself in a bind. One of the other things that's interesting is that anytime you mess around with spleens, taking them out, there's a risk of arrhythmias. There's a risk of irregular heart rhythms. And this doesn't seem to be unique to hemangiosarcoma, although it can be exacerbated in dogs that are anemic. So we can often see irregular heart rhythms during and after surgery in dogs who have their spleens out. So we recommend actually really careful looking at the heart rhythm during surgery. And usually we like them to be monitored for about 24 hours after surgery as well to make sure they're not developing any irregular heart rhythms that might require medication to treat. So the good news is, if we do see these heart rhythm irregularities, they're the kinds of irregularities that usually respond quite readily to medications, and they usually don't happen long term. So they might need medications for a week or two, and then usually they go away. But it is something that's worth looking out for. And then the third thing we want to do is, again, take a really good look around the whole abdomen while we're in there to make sure we don't see anything else that looks like spread. So look at the peritoneum, look at the omentum, look at the liver, etc. And then we like to actually wash out the belly really thoroughly with sodium chloride so that we can wash off potentially any little tumor cells that might be stuck on there to try and help to diminish the likelihood of spread again. And then we do recommend changing the instruments prior to closure because we have seen evidence of actually recurrence of hemangiosarcoma at the suture line on the belly, for example, after surgery. And if the instruments are changed at the time when we're closing, we can actually avoid that complication. So what about the heart tumors? Is it possible to do surgery for them? The answer is sometimes yes. So there's a nice little case series that was written up by Dr. Chick Weiss, a surgeon who's now at the Animal Medical Center now about 10 years ago or so. So the most common location for us to see these tumors in the heart is actually in what's called the right atrial appendage, which is kind of a little bag that sits right off kind of the edge of one of the chambers of the heart. And one of the nice things is that when these are relatively small lesions that are really localized to that right atrial appendage, you can dispense with that. You can actually cut out the right atrial appendage and then just sew the little bit of the heart back together. This is not a surgery that I could do. I can't even do a cat spay. I'm a medical oncologist. But I've been told that in the hands of a surgeon who does a fair bit of thoracic surgery, it's not an excessively challenging procedure. The postoperative morbidity rate is actually very low, so the likelihood of serious complication in this case series was only about 15%. And then the outcome long-term was about the same as dogs who have hemangiosarcoma at other visceral sites, which is not particularly great. But certainly much better with surgery than without. So see, something to keep in mind, for those specific cases where it really appears like it's only in that right atrial appendage and you can't find it anywhere else. So what's the outcome with surgery in these guys? So as I mentioned before, these dogs that have purely cutaneous hemangiosarcoma, and again, this little bull terrier, or maybe it's a pitty, over here on the right, has a pretty common sort of presentation like this, where you see these sort of multifocal, sort of red, splotchy sort of regions, kind of all around the groin area. So when we see these, either if we have more than one or if we have a single one, these don't tend to spread very often, actually. So if you can do a complete removal, they tend to do very well. The real problem with these is that, again, we think that they're ultraviolet related, and all of that skin down there has been exposed to the same amount of ultraviolet light. So our fear is that they can get more tumors down the line. So not a form of spread, but just other tumors arising. And this can be a mixture of both benign and malignant tumors, not only hemangiosarcomas, but we can see squamous cell carcinomas occur, sun-induced as well in these same guys, and a lot of these guys will end up with a mixture of different kinds of sun-induced tumors, some benign, some malignant. They may never spread, but can grow and multiply to the point where surgery is not possible. And again, in serious cases, they can become open, oozing, bleeding, nasty, infected, things like that. But again, for those dogs that have single or just a couple localized, small, cutaneous hemangiosarcomas, these dogs can actually do great. And we can sometimes see these in non-light-skinned, non-short-coated dogs in random places in the body. And similarly, those dogs tend to do very well even if they're not sun-induced. So dogs with visceral hemangiosarcoma, spleen, liver, heart, etc. In these dogs, as I mentioned at the very beginning, unfortunately the outcome is quite poor. So the reported average survival time is in the neighborhood of 1 to 3 months after surgery, even if you can't find anything that looks like spread on any of your pre-treatment surgical tests. So we know that about 90% of these dogs do have spread somewhere else. It's just so small we can't see it when they come in. Less than 10% of dogs will make it to a year with surgery alone, unfortunately. So one interesting exception to this rule might be the kidney. And in one small case series of maybe 10 or 12 dogs that had primary kidney hemangiosarcoma, their average survival time was about 9 months, and most of them just had surgery. So those guys may do a little bit better than sort of most of the other visceral sites of hemangiosarcoma with surgery alone. Subcutaneous hemangiosarcoma is a tricky one. So not the true cutaneous ones that's sitting on the skin surface, but these tumors that occur under the skin, but not inside the body cavity. And the reason that these can be really tricky is because the literature is sort of all over the place as far as how these dogs do. It's actually very frustrating. So one study that actually came out of CSU about 12 years ago or so looked at the outcome in dogs specifically with subcutaneous hemangiosarcoma that had surgery alone. And they reported that more than half of the dogs who just had surgery were doing fine at a year, which was pretty optimistic, certainly compared to what we see with our visceral hemangiosarcomas. Then a couple years later, there was a study that looked at a combination of surgery and chemotherapy with the injectable drug doxorubicin that we'll talk about more in a second. And this was great. Their average survival time was 3 years with this combination of surgery and chemo. And we went, hey, great, maybe this disease isn't as bad as we thought. But then a couple years after that, another study looked at the exact same treatment, so a combination of surgery and doxorubicin, and ended up with an average survival time of only 9 months. So again, this is why sort of it's very, very hard for us to talk to an owner about what to expect with this particular form of the disease. I think they're better than the average visceral hemangiosarcoma, but they certainly do have the potential for aggressive behavior. So we do recommend full staging to make sure there isn't disease elsewhere. And then we do recommend chemotherapy to follow as if this was a visceral hemangiosarcoma. Although, again, the outcome does have the potential to be at least a little better than that. So what about medical therapy for this disease? So the average sort of standard chemotherapy protocols that we've all been using for a very long time to treat this disease roughly triple the average survival time. So we go from an average survival time of 1 to 3 months with surgery alone to an average survival time of something like 5 to 6 months with surgery followed by chemotherapy. Unfortunately, the likelihood of long-term survival, so the likelihood of making it to a year or beyond, really doesn't budge with the addition of these other drugs. We're still looking at a less than 10% chance of making it to a year. Those dogs that do make it to a year are pretty likely to do well for quite a while after that and probably die of something else. So that's great. But unfortunately, again, the standard therapies that we have, yep, the average dog does better. And actually, they're pretty easy. They're not that poorly tolerated. Most dogs will do very well with them. And the average dog does 3 times better. So that's fantastic. But if we have an owner who's looking for cure, for a higher likelihood of cure, unfortunately, these conventional treatments don't really offer that. They do kick the can down the road, and most of the dogs feel great the whole time they're getting treated, but we don't see an uptick in the number of dogs that are long-term survivors. So the standard chemotherapy protocols that we have been using for 20, 30 years and that we're still using all revolve around one drug, and that's doxorubicin. This is probably the most commonly used chemotherapy drug in the whole world, not just in dogs, but in people too. And some people will give it by itself. Some people will mix it up with other drugs, so a drug called cyclophosphamide, another drug called vincristine. The outcomes are relatively similar between the different doxorubicin-based protocols, so it's a lot of matter of sort of personal individual preference. Doxorubicin is given as a quick injection into a vein, just once every 2 to 3 weeks. And again, it's generally very well tolerated. We really don't see a lot of side effects from it. It's also become relatively inexpensive over the last few years as well. So this is something that doesn't make a lot of dogs sick, doesn't require a lot of time in the hospital, doesn't cost a whole lot, and the average dog does about 3 times better than a dog that doesn't get it. So I still feel like I can look at an owner in the face and say, hey, this is our standard of care, and it does help, although certainly not as much as we'd like. There's one really interesting study that was published quite a while ago now that actually looked at adding doxorubicin, or adding to doxorubicin, a form of immunotherapy, so a drug called LMTPPE. LMTPPE is a drug that is actually approved for the treatment of bone cancer, osteosarcoma, in people in the European Union. It's not approved in the United States, but it is approved in the EU. So if you happen to be logging on from the EU and you've got a client with very deep pockets, this is something that could be purchased and given to a dog. The approximate cost for a course of therapy for your average size Labrador is probably in the neighborhood of $30,000 or $40,000. But this is really, up until very recently, this is in fact the only randomized placebo-controlled trial that's demonstrated a treatment that's superior to doxorubicin-based chemotherapy. So dogs that got a combination of regular old chemotherapy and LMTPPE actually had an outcome that was about 50% better than dogs that didn't. So their average survival time was more in the neighborhood of 8 or 9 months. And the interesting thing was about 30-ish% of these dogs were actually long-term survivors. They did well for more than 1 to 2 years. So super exciting. Wish this was a drug that was easier for us to give here in the United States and more affordable. So there certainly are some folks who are looking for MTPPE-like alternatives that might have similar activity. But unfortunately, as things stand right now, we don't have any tools like that in our toolbox that are guaranteed to work. I will mention a couple things that are being looked at, though, coming up here. So the numbers that we are able to give owners, so 1 to 3 months with surgery alone, 5 to 6 months with surgery plus doxorubicin, those are averages. They're not maximums, they're not minimums. And the way that we get these averages is that half the dogs do better than that average mark and half the dogs don't do that well. It's always impossible to look at an individual dog and know for certain where they're going to fall on that spectrum. But there are a couple things that we know about that can help us to sort of make an educated guess. One of them is, has the tumor, again, this is specific for visceral tumors, has the tumor ruptured before we take it out? So some dogs, again, we're able to actually get that tumor out of there before it's ever ruptured, and statistically those dogs are likely to be on the high side of the average mark. On the flip side, as I mentioned before, dogs that have obvious evidence of spread that's big enough that we can see it tend to have a very poor outcome on the low side. There's one paper that actually looked at a grading scheme for hemangiosarcoma, was actually able to sort of look at it under the microscope and say, hey, how bad does this look? How weird are the cells, etc. And in that one paper, that grading scheme actually did have some prognostic significance. So dogs with low-grade tumors, as you might expect, had a better outcome than those dogs that had intermediate or high-grade tumors. And for cutaneous and subcutaneous hemangiosarcoma, whether surgery is able to remove all of the disease or not is an important prognostic factor. So tumors that are incompletely removed tend to have a much worse outcome than tumors that are completely removed. So what about those patients that have tumors that we can't resect, that we can't remove because of their location or their size, or tumors that have already spread? Doxorubicin-based chemotherapy remains kind of the best tool in our toolbox here. And we're looking at about a 40% likelihood of seeing meaningful tumor shrinkage with these conventional chemotherapy drugs. And the average amount of time that shrinkage lasts for is in the neighborhood of about 2 months. So not so great. But again, compared to dogs who don't respond, certainly these dogs certainly do benefit. I can look at an owner in the eye and say, yep, your dog does have the potential to do better if we do this than if we don't. But obviously the outcomes aren't nearly as good as we'd like. There are some tumors that haven't spread but are too big or too invasive to be able to remove. And we have looked at the ability of radiation therapy to try to improve the local signs in dogs that have these big tumors. So pain, swelling, inflammation, bleeding, etc. And some improvement in outcome and some reduction of size is seen in about 70% of dogs that get actually a fairly simple outpatient once weekly form of radiation therapy. There's also a more fancy CAT scan guided form of radiation therapy that has just been reported to be used in a small number of dogs with cardiac hemangiosarcoma. And it appears that dogs that receive this kind of radiation therapy to their heart actually have a significant reduction in the accumulation of fluid around their heart that's responsible for a lot of the clinical signs that we see. So complicated, expensive, very well tolerated, and not widely available. So a very interesting finding, something that I'd love to see investigated a little bit more, but again, really something that's still mostly a palliative measure. So one of the things that a lot of you may have heard about is what's called metronomic chemotherapy. And this is an idea of delivering little tiny doses of chemotherapy in a continuous fashion instead of big boluses of chemotherapy once every few weeks. And this is an interesting concept that's actually been explored quite a bit in mice and humans and a little bit in dogs. And the idea behind this kind of therapy is that it probably doesn't kill a lot of the tumor cells directly, but it actually may interfere with the growth of normal blood vessels that are still necessary even in hemangiosarcoma to provide nutrients and oxygen for the tumor cells. And it may also do some beneficial things to the immune system. So there was one very, very, very small study of only 9 dogs with splenic hemangiosarcoma that actually used 2 different chemotherapy drugs. One is a drug called cyclophosphamide, which is a pill, and one of them was a drug called etoposide, which was actually given as an oral solution, which is something that we don't recommend because of safety reasons. And then they combined that with an aspirin-like drug called piroxicam. And in this very, very small study, it appeared that the outcomes in dogs that got this metronomic chemotherapy was around the same as dogs that got conventional doxorubicin-based chemotherapy. So how do I view metronomic chemotherapy for these dogs? You know, there have been lots and lots and lots of studies that have actually been much bigger than this one that have demonstrated over and over again that doxorubicin-based chemotherapy improves the outcome in dogs with hemangiosarcoma. All we have to hang our hats on with metronomic chemotherapy is this one very, very small study. So I think when I sort of talk to owners about medical therapy for hemangiosarcoma, I still really consider to be injectable chemotherapy with doxorubicin to be the way to go. But again, if I've got an owner where they say, I just can't do that, that's not going to work for me, and it ends up being a choice between doing nothing or doing metronomic chemotherapy, again, with perhaps just cyclophosphamide and piroxicam, I'll say, sure, absolutely. You know, based on this one very small paper, it might be a little better than not doing any form of therapy. It might even be as good as injectable chemotherapy, but again, we just don't have the information to be able to say that with certainty. So it's a great sort of second-tier choice if injectable chemotherapy is off the table, is how I think about it. There's a very small study that came out recently that looked at both. So, hey, injectable chemotherapy seems to do some good. Metronomic chemotherapy seems to do some good. What happens if we put them together? What happens if we do injectable chemotherapy first, and then if everybody's doing fine, then give them metronomic chemotherapy afterwards? So in this very, very small study, it did appear that dogs that got metronomic chemotherapy after conventional chemotherapy with doxorubicin had a surprisingly good outcome. So in this study, more than half of those dogs were alive at a year and beyond. The simple version is really most people don't believe this data. So most of us have tried this in at least a handful of dogs and have seen results that are nothing like what this group from Italy has reported. So I remain very skeptical about these results and would really like to see them confirmed in another study by another group. I'll come back to this in a second because there is one little interesting supportive piece of information that says this may not work as well as we think. Is it worth considering? Sure, I don't see the harm, but I don't in any way believe the data that's in this paper. There's a drug out there that some of you may have heard of called Palladia. Palladia is actually a drug that's approved for the treatment of not hemangiosarcoma, but another disease called mast cell tumor in dogs. And in addition to being useful for mast cell tumor, it may be useful for a variety of other kinds of tumors as well, occasionally, not necessarily for directly killing the tumor cells, but interfering with the growth of blood vessels. Since hemangiosarcoma is made up of blood vessels, it was a fairly logical thing to take a look at Palladia to determine if dogs who got Palladia after chemotherapy might do better than dogs that didn't. And the results of this study were really that there didn't appear to be a lot of improvement in outcome in those dogs that had conventional chemotherapy with doxorubicin and then had sort of quote-unquote maintenance treatment with Palladia after that to try and keep their tumors away for a longer period of time. So average survival time was about 6 months. Again, not really significantly different than dogs that just get doxorubicin. There is one little tiny interesting thing to look at, and that is that the likelihood of being a long-term survivor was, more like in the neighborhood of about 15% in this study versus an average of about 7% with conventional chemotherapy alone. So it's possible that a small subset of patients with hemangiosarcoma might benefit from this kind of therapy. The problem is that we don't know, which of the dogs that's going to be, and this is actually a very expensive medication that does have some side effects. So I think based on the information that we have right now, it's not something that we can generally look at an owner and say, oh yeah, we should definitely do this after surgery based on the information that we have. So what are some other possibilities? What are some things that are being looked at? So we might not have firm data, but what are some things where there's a little bit of information to say that this might be something that's worth looking at or worth considering? So we'll talk about a bunch of other things. So there's some other conventional chemotherapy drugs that have been used in some people, beta blockers, a drug called Yunnan Biao, a mushroom-derived thing called Immunity, a brand new thing, a targeted therapy called EBAT that comes from the University of Minnesota, a blood pressure drug called losartan, and then a drug that inhibits, again, AKT signaling, which is that pathway I mentioned that appears to be dysregulated in some hemangiosarcomas. So let's go through these a little bit and just let you know what's out there and what we know. So other conventional chemotherapy drugs. Yeah, in fact, there are some. In people, the drugs that seem to have the most activity, as I mentioned, hemangiosarcoma is really, really rare in people. So the amount of information that they have is quite limited. But the drugs that appear to be the most effective in people are actually not doxorubicin. One of them is a drug called Taxol or Taxotere, and the other is a drug called gemcitabine. Both of these are drugs that can be given to dogs. Gemcitabine is actually quite well tolerated. Taxol is problematic, but Taxotere is much easier to give and has very recently become considerably less expensive. So taking a page from the human book, some folks are quite interested in exploring Taxotere and or gemcitabine as maybe more effective conventional chemotherapy drugs for this disease. Another one is carboplatin. So carboplatin is a drug that we've used for an awful long time in dogs, probably 20 years or so, to treat other kinds of cancer, specifically osteosarcoma and some kinds of carcinomas. And we recently completed a study of about 20 dogs or so with splenic hemangiosarcoma that got carboplatin after surgery. And it looks like their outcome's about the same as dogs that get doxorubicin. So no better, no worse, but there is a subset of dogs where doxorubicin might not be a great drug for them. So if they have pre-existing heart disease, for example, where it does look like, based on the information that we have, carboplatin might be a pretty reasonable alternative. So what about this beta blocker thing? So again, there are a number of different beta blockers that are taken for heart disease in people all the time. One of them is propranolol. And about, I don't know, 5 or 7 years ago now, people made an observation in kids that sometimes we'll see kids with these big, very, very red or purple tumors on their face. These are hemangiomas, so not hemangiosarcomas, but benign versions of the same disease. And they discovered sort of accidentally that propranolol can really shrink these tumors up quite remarkably in these kids with life-threatening hemangioma. There is some work, again, that comes out of the University of Minnesota that suggests that canine hemangiosarcoma cells actually do have beta-adrenergic receptors on their surface, and these are the receptors that are inhibited with drugs like propranolol. So they haven't demonstrated that they're active, they haven't demonstrated that activating these receptors results in changes in cell behavior, but they're there, which is encouraging. And then if you actually take propranolol and dump it into a petri dish with canine hemangiosarcoma cells, you can in fact kill them. So this little graph actually shows that the more drug you put into this petri dish, the more you're able to inhibit the growth of canine hemangiosarcoma cells. So this is really exciting, but the dirty little secret is the concentrations that you're seeing in this little petri dish experiment are about 1,000 times more than what you can get into a patient. So this is so much drug that you could never reach these concentrations in a person, or in a dog for that matter. So that being said, there are some folks who are using propranolol along with conventional chemotherapy in an attempt to make it work better. And actually, we're one of those sites. So we're currently offering to add propranolol to our conventional doxorubicin-based chemotherapy, not because we know it works, but because there's enough indirect evidence to say, hey, this is something that maybe we could consider. And we do know of a dose that's quite safe and well tolerated. It's also not a particularly expensive medication. At this point, we've treated enough dogs with the combination to say that it appears to be very well tolerated. So we don't see worsening of the side effects from the doxorubicin, for example. But whether it's effective or not, we can't say. Unfortunately, this is going to be our story for most of these new therapies that I'm talking about. Looks interesting, can't say for sure if it works. Yunnan Baiyao is one that gets an incredible amount of attention and press. So this is a traditional Chinese medicine that was developed actually, I think, by an army guy kind of back in the 40s or 50s as a way to potentially reduce bleeding from wounds. It's a mixture of a few different ingredients. I think there may be up to 8 different ingredients. And there certainly are some studies where it's used topically on a wound, appears to maybe be able to reduce bleeding. There is one study in humans who are actually undergoing facial surgery that suggested that the amount of blood loss that occurred during the surgery was a little less in people who were pre-treated with Yunnan Baiyao. So what do we know in dogs? So in dogs, this is kind of a recap of the propranolol data. If you dump enough Yunnan Baiyao into a petri dish, you can inhibit the growth of canine hemangiosarcoma cells. I think that the amount of Yunnan Baiyao that's necessary in order to do this is, again, far more than what you could actually get into a dog with conventional dosing. So I think the likelihood of this concoction having really meaningful anti-tumor effects by themselves is very low. A lot of people use it because they think maybe it'll decrease the likelihood of another bleeding incident in the future. So there are actually 2 studies that have been reported looking at blood clotting ability in normal beagles after Yunnan Baiyao is administered, and there's absolutely no difference in blood clotting ability whether dogs receive Yunnan Baiyao or not. So that doesn't completely rule out the possibility that if you have a dog who's already not clotting their blood that well, that the results might be different than in a dog who starts out being totally normal. I guess my personal philosophy about this is that I think the reason that dogs with hemangiosarcoma bleed is because their tumors are very fragile and they're full of blood. It's not necessarily because there's all that much disorganization in their ability to clot their blood. So I'm a little bit of a skeptic, but the flip side is it appears to be relatively harmless. One of the things I'll say that's true for all of these herbal supplements is we do not know whether there are any interactions with other conventional chemotherapy drugs. So is it possible that the concurrent use of Yunnan Baiyao and chemotherapy might interfere with the chemotherapy effectiveness or make it more toxic or something else? Possibly. We just don't know the answer to that. There is one additional study that was published very, very recently that actually looked at the ability of Yunnan to decrease bleeding episodes in dogs with pericardial hemangiosarcoma. And the answer was no. In this group of dogs, there was no difference in how long it took them to have another bleeding episode, or how long they survived, whether they received Yunnan or not. So unfortunately, based on this additional study, even in dogs with hemangiosarcoma, there's no obvious evidence of a benefit. So what about immunity? So this is a drug that got a lot of press 5 or 6 years ago because of a very, very small study that was done at the University of Pennsylvania. So this is a peptide that's actually derived from a fungus. The fungus is called Coriolus versicolor. And it does appear that if you, again, sort of dump this stuff into a petri dish, you can actually stimulate the immune system. And specifically, it looks like you can stimulate the function of a cell called a macrophage. And these macrophages may be very important for helping to either promote or suppress tumor growth because of the kind of environment that they create in that tumor region. They may be immune stimulating in certain circumstances, and other macrophages may actually help the tumors to grow, maybe tumor stimulated. And stimulation of these kinds of receptors like TLF4 and MYD88 that you see on this slide may help to promote macrophages that have a less tumor promoting job in the tumor. So there's really nothing about using this drug in people, in cancer at least. And again, there was this very, very, very small study that was reported about 8 years ago in dogs with hemangiosarcoma. 15 dogs received this drug. 5 of the dogs who received the highest dose had numerically improved outcomes compared to dogs that received the lower doses. That is the extent of the information that we have about this compound. So Penn has had an open clinical trial for years to try and validate these findings, and to my knowledge, they have not been able to sort of recruit enough patients to sort of answer any meaningful questions about this. So again, is this something that could be useful? Yeah, maybe, based on this small 5-dog cohort here, but really the question still remains unanswered. And again, we're faced with the possibility that there could be some drug interactions if this drug, for example, was used with more conventional chemotherapeutics. So EBAT is this new thing. There was just a study reported just a couple of months ago in some dogs with hemangiosarcoma. And again, this is work that comes out of the University of Minnesota. So EBAT is a toxin. So this is actually a very, very potent toxin called the Pseudomonas exotoxin. And if you just gave huge amounts of this toxin to a patient, it would kill them. But what they've done here is they've actually linked up this toxin with a growth factor called epidermal growth factor. And that allows this toxin to be targeted very specifically to cells in the body that express large amounts of epidermal growth factor. Some data was presented to suggest that dogs with hemangiosarcoma may have high levels of expression of the receptor for epidermal growth factor, which is called EGF receptor. And as a result, they did some work in a petri dish that said that, yep, you can actually kill hemangiosarcomas with this toxin. So that actually led to a clinical trial of about 20 dogs or so that received 3 doses of EBAT. So everybody had a splenic hemangiosarcoma. They had splenectomy. And then within a few weeks of splenectomy, they would receive 3 doses of this EBAT as an injection every other day. And then a few weeks later, they'd start conventional chemotherapy with doxorubicin, and then they were monitored thereafter. So it appeared to be quite well tolerated. And when you compared the outcome in dogs that received EBAT followed by doxorubicin to dogs that received doxorubicin alone, there appeared to be an improvement in outcome. So the average survival time was about 8 months in dogs that received the combination versus about 5 months in dogs that received doxorubicin alone. So this is certainly very interesting and encouraging, but there are some things to keep in mind here. So this is not a randomized study. So the dogs that received EBAT were compared to old dogs, old historical dogs that received doxorubicin. One of the things that I'll mention, if I just go back to this slide, is an awful lot of the doxorubicin control dogs in this group actually got doxorubicin followed by metronomic chemotherapy. And again, their outcome was nothing like the outcome that I showed you in those Italian dogs previously. But there was limited comparison performed between the treatment groups and the control groups in terms of how long between the tumor coming out and chemotherapy being started, grade of the tumor, stage of the tumor, those kinds of things. They were followed up differently as well. So the EBAT dogs were followed very carefully. the control dogs not so much. And there may have been some difference in staging, so in the tests that were performed between the two groups of dogs too, that may have inadvertently selected for actually dogs that had the potential to do a little better because they may have had less metastasis. So very, very interesting, very cool, very keen to see more information come out about this. This is something that's not currently available. And the last time I checked, there didn't appear to be any ongoing studies with this medication at the University of Minnesota or elsewhere. So what about losartan? This is actually another really interesting one. And again, one that's a commonly available drug that's used all the time in people, this time for blood pressure, actually. So this is a blood pressure medication. And the logic behind looking at losartan actually comes from a study out of CSU here from Dr. Dow's lab, looking at, again, those macrophages that I mentioned previously. So these white blood cells, these immune system cells called macrophages, that can either be positive for the tumor or negative for the tumor, depending on the circumstances. And it looks like actually hemangiosarcomas have a lot of these macrophages in them. And it's hypothesized that these are tumor-promoting macrophages, not the immune system stimulating macrophages. So they're bad macrophages. So hemangiosarcomas have an awful lot of macrophages in them, and it appears that one of the main reasons that the macrophages get here is because the tumor cells secrete a lot of a hormone called CCL2, which kind of serves as an attractant signal to macrophages. And the little graph that you see on the right actually shows that if you put hemangiosarcoma cells in a petri dish and ask macrophages to actually migrate toward them, they do that really, really well. But if you block this hormone called CCL2, you can actually interfere with their ability to migrate towards the tumor. And this really forms the basis for an idea to look at losartan as a cancer therapy in these dogs. So this, as I said, is a very commonly used blood pressure medication in humans. We actually know that it's tolerable in dogs, so it's been looked at. And it appears to actually be a blocker of this hormone, this CXCL2 hormone, which is important in stimulating these macrophages to come to hemangiosarcoma as well as some other tumors. So there is actually an ongoing study at the Animal Medical Center in New York comparing doxorubicin-based chemotherapy alone to doxorubicin combined with losartan. So that study is ongoing, and again, we're really looking forward to seeing what those results end up looking like. This is actually a kind of therapy that could be applicable to other forms of cancer as well, but hemangiosarcoma is the one that's being looked at first. So stay tuned about this one. This is actually pretty exciting. And finally, I'll mention very briefly about this class of drugs. So I mentioned before that a fair number of hemangiosarcomas actually have mutation or inactivation of a protein called PTEN, which is really important for regulation of this pathway that you see on this slide, the AKT pathway. And again, the AKT pathway is really critically important for cell survival, cell migration, cell proliferation, cell chemotherapy sensitivity, a lot of other things like that. And there have been some very nice studies performed that suggest that hemangiosarcoma is a tumor type that actually has very, very high activation of this pathway, which means that maybe it would also be a very good tumor type to interfere with signaling through this pathway. So there's a drug that's being developed by a company here in Fort Collins, Colorado called VetVC, called VDC-597. And VDC-597 is an inhibitor of actually two different parts of this pathway. One is at the very top called PI3 kinase. So that's up at the very top there. And then it's also an inhibitor of mTORC1 and mTORC2. And mTORC1 is the little pink guy that you see on your slide there. And mTORC2 is up toward the top, the orange guy. So this actually inhibits signaling through this pathway at multiple points. And actually, we've looked at the ability of this drug to inhibit growth in a variety of tumor types. And actually, hemangiosarcoma cells are one of the most sensitive kinds of cells as far as growth inhibition goes. And just to put this in perspective, the amount of drug that we're capable of getting into dogs is an amount that actually is capable of inhibiting growth in these cells. In addition, we can see inhibition of migration of tumor cells treated with this AKT inhibitor VDC-597. And we can see really significant reduction in production of this growth factor that I mentioned at the beginning, vascular endothelial growth factor as well. So all of these factors, and in the fact that we've completed a study in dogs so that we know how much to give and how often to give it, et cetera, have led to actually a study that's about to start here in Colorado looking at this drug, VDC-597, which is a pill that's given at home 5 days a week for the postoperative treatment of dogs with splenic hemangiosarcoma. So dogs will have their spleens removed. If they're disease-free at the time they start treatment, they'll be treated with VDC-597 as a single agent and followed for their outcome. So stay tuned for this one as well. So how about diagnostics? So what's new in actually achieving a diagnosis or doing screening for dogs with hemangiosarcoma? So one of the things that we know is there are lots of diseases in dogs that can present as splenic masses or liver masses or things like that besides hemangiosarcoma. So there are some fancy imaging tests using things like MRI, certain kinds of fancy ultrasound, and certain kinds of CT scans that appear to have some ability to be able to distinguish between benign and malignant disease in the spleen and liver. Tends to be better for the liver than it is for the spleen. And again, most of these tests require sophisticated equipment and general anesthesia, which many dogs may not be suitable for if they present acutely with problems. There's an easy enzyme that you can measure in the blood of dogs called cardiac troponin I, which is an indicator of heart muscle damage. And it appears that cardiac troponin I is much higher in dogs with hemangiosarcoma than it is in dogs with what's called idiopathic hemopericardium. So there's some, again, golden retrievers that appear to occasionally get blood in their pericardial sac for no reason. And cardiac troponin I, which is a send-away blood test, actually appears to be reasonably good at being able to make a distinction between those two situations, which is great. There's another paper that's just come out of University of Minnesota using a very fancy test called PET-CT imaging for hemangiosarcoma staging, and it looks at the whole body all in one test. But again, there are very few places around that can do it. It's about a $2,000 test. It does require general anesthesia. But again, it may be very, very sensitive. So in other words, you may be able to pick up very small areas of spread using this methodology that you can't with more conventional testing. One of the things that sort of we in the veterinary profession have thought for a long time, sort of one of these old wives' tales, is that dogs that present with very, very, very big splenic masses. Some dogs will come in and they're feeling okay, or they're just a little bit slow, and they have like a basketball-sized or a volleyball-sized mass on their spleen. And for a long time, there's kind of been this rumor that, oh, you know, the bigger the mass is, the less likely it is to be hemangiosarcoma. And the logic behind that is that hemangiosarcoma is such an aggressive disease that most dogs will have run into serious, serious problems before their tumor had a chance to get that big. So a couple of years ago, there was actually a study back in 2011 that came out that looked at this scientifically. And in fact, that was exactly what they found. So benign splenic lesions were likely to be considerably bigger than hemangiosarcoma splenic lesions. So in fact, this thing that we've said for a long time that, hey, the bigger your splenic mass is, the less likely it is to be hemangiosarcoma, actually appears to somewhat hold true scientifically. So it's by no means an exact science. So there's some really big ones that can be hemangiosarcomas. There's plenty of really little ones that are benign. So it's not a guarantee. But playing the odds, if you have a dog with a really big splenic mass, you know, one of these softball or baseball or basketball-sized masses, you know, the odds that it's hemangiosarcoma might be a little less than average at worst. And again, for some owners, that could make the decision between whether they choose to go to surgery or not for that particular dog. So what about screening? You know, so this is, I mentioned previously that, hey, if we can detect this early before it ruptures, these dogs may not be cured, but they certainly have a better outcome than those that rupture. Some of the dogs that develop this disease, again, they have a life-threatening or fatal episode of bleeding the very first time anybody knows anything is wrong with them. So are there screening approaches that could be done that might help to detect this earlier? So one of the things that some really dedicated owners will do is, hey, they just bring their dogs in for ultrasound and chest x-rays once every 6 months or some period of time just to look and see if there's any abnormalities there. But what's the magic number? How often should we be doing this? We don't know. And how good a test is it? Like how much time does it take for a spleen to turn from being completely normal into being a spleen that has hemangiosarcoma? We don't know that either. So is it wrong to do these tests? No. Is there any harm in doing it? Other than the possibility of finding something that leads to additional diagnostic tests or surgery or things like that that a dog might not need, I can't think of a big downside. But again, we don't have a lot of scientific evidence to say, well, how often should I do these ultrasounds and is it of any use? So we really don't know that, unfortunately. Again, Dr. Modiano's lab actually developed a flow cytometry-based assay. So this was a blood test, basically. You could send a tube of blood away, and he would look at the cells that were floating around in the blood and could identify a small population of cells in certain dogs that looked like hemangiosarcoma cells. But this is a test that's not commercially available, and I think there were issues with reproducibility. When they tried to move it to a commercial lab, they had a hard time making it work the same way. So I think it requires a ton of really sophisticated expertise that this commercial lab didn't have in order to do. So that's not something that's commercially available. There is one assay that is commercially available, and that's an assay for a hormone called thymidine kinase. Actually, now it's a part of a two-pronged test that measures thymidine kinase and another marker as well. So what's thymidine kinase? So thymidine kinase is actually an enzyme that's important for cells to divide, for cells to replicate their DNA. And tumor cells, which are rapidly dividing, actually require more of this enzyme than normal cells do. So that's the theory about why you're more likely to have this high enzyme in dogs with cancer. And it appears that there's only certain kinds of cancer where this enzyme leaks out into the blood in a way that allows it to be measured. And the one that's been the most studied is actually lymphoma. So dogs with lymphoma have actually very high levels of this enzyme. And the more lymphoma you have, the higher stage lymphoma you have, again, the higher levels of this enzyme. So we took a look a few years ago at some other kinds of cancer to see if we could find other tumor types where thymidine kinase was high, and actually one of the ones that we discovered was hemangiosarcoma. And this led to a study that actually looked at dogs with hemoabdomen, so dogs that had had a bleeding episode into their belly and had a splenic mass, to look and see whether thymidine kinase was more elevated in those dogs that ended up having hemangiosarcoma than in those dogs that had bleeding spleens for other reasons. And the answer was yeah, in fact, thymidine kinase levels were higher in dogs with hemangiosarcoma than in the other groups, but there was a lot of overlap. So there were some dogs with hemangiosarcoma that had normal thymidine kinase levels. There were some dogs without hemangiosarcoma that had high thymidine kinase levels. So it was by no means a perfect test. And again, so the practical problem with this is that this is a send-in, it's a mail-in test. You know, if you've got a dog with a bunch of blood in its belly, usually that dog needs to have surgery right away, and it's not usually appropriate to send a tube of blood to California and wait for the results to decide what to do. So how could this test be used? I'm not suggesting that it's the best test for everything, but one would be if you had a dog that did have one of these routine ultrasounds and they found a little mass on the spleen, and you said, geez, I wonder how concerned I should be about this. If I did this thymidine kinase test and it was high, maybe I'd be more inclined to go ahead and get that spleen out of there sooner. If it was low, maybe I'd be a little bit more inclined to maybe recheck it. But again, it's not a perfect test. There are some dogs with hemangiosarcoma that have normal TK levels and vice versa. Could it be used as a screening test? So, hey, should I send a tube of blood to this company in California once every 6 months, and if it's high, then go on my tumor hunt with ultrasound and chest x-rays? So it's an intriguing concept, but again, we don't have any data yet to say that this is something that's worthwhile. So it's relatively cheap, it's non-invasive, but again, is it useful? We can't say that it is. So the current version of this test actually measures something that the company is calling the neoplasia index, which is a combination of thymidine kinase and another marker called C-reactive protein. And this combination actually appears to be elevated in quite a few dogs, not only dogs with lymphoma and hemangiosarcoma, but also malignant histiocytosis. So again, this was just sort of a one-time measurement in dogs that already had biopsy-confirmed disease. So it doesn't imply that it would be useful as a screening test, but it does appear that it's elevated in dogs that have obvious evidence of disease. So could this be useful? Possibly. Is this something that I'm recommending that everybody do? No, not at all. And again, in the interest of disclosure, we did some of the work about hemangiosarcoma with this particular test. And again, I do get like $35 twice a year as a result of the performance of this test. So I'm not hawking this as something that everyone should do. But could it be something to consider? Maybe, and I'd love to see more work done on it. So what about prevention? Do we know anything about prevention? Just wrapping up here in the last couple of slides. The big thing that we know is that in those dogs that have these multiple cutaneous hemangiosarcomas in regions like their groin, sun avoidance is the #1 thing you can do to improve the long-term outcome for these dogs. So keep them out of the sun as much as you can. There are actually some companies that make UV protective sunsuits for dogs that you can actually put on them when they go outside. People ask about sunblock and things like that. I'm not a huge fan because usually the dogs just lick it right off. So I don't think that that's very useful, unfortunately. And there's a really interesting study in people that came out a year or two ago now that actually looked at vitamin B3, which is also called nicotinamide, in people with a history of multiple sun-induced skin cancers. And in people who got nicotinamide, their likelihood of getting more skin cancers, squamous cell carcinomas or basal cell carcinomas, was actually significantly reduced by something like 20 to 30%. So does that mean that that's the case in dogs? No, it certainly doesn't mean that that's the case in dogs. But we do use nicotinamide for some other skin conditions in dogs, so we know a dose, we know that it's very safe. If I had a dog with a history of multiple presumed sun-induced cutaneous hemangiosarcomas, I do think it's something that I would probably consider doing for my own dog, just again because of the information in people and because it does appear to be very, very safe. So that's essentially what we know. One of the questions that we get a lot is, again, what about routine preventative care? Should I stop giving my dog heartworm pills? Should I stop using flea and tick drops? So there's no evidence whatsoever that we know about that these things are contributing factors to the development of hemangiosarcoma. What about vaccines? Am I vaccinating my dog too frequently? Is that doing something that's going to predispose them to hemangiosarcoma? Again, no data whatsoever to support an increased risk of any kind of cancer from vaccination. So we certainly still strongly support all the routine preventive care that's keeping our dogs healthy until there's really solid proof that there's a reason not to. So there's so many diseases that are avoided or prevented through the routine care that we all take care of our dogs, that the last thing that we would want to do is sort of withhold those and then have them run into one of these preventable diseases. So definitely keep up with your vaccines, keep up with your heartworm preventative. There's no evidence that we're changing or that we're changing the risk of hemangiosarcoma by doing those things.
Thank you, Dr. Thams. I want to thank you so much for some wonderful information on this topic. Thank you so much for sharing your knowledge with us tonight.
Great. Thanks again, Sherry. And again, a big shout out to the AKC Canine Health Foundation for helping to sponsor this great event. And I really hope that it was helpful for folks.
Thank you, Dr. Tham.